Hello. Hello.
Hi.
Hello. Good
Hi,
afternoon. How are you?
we are fine, and you?
We are fine. What about you?
I'm not fine, but I'll
And
manage.
your
I
voice?
have, yes, I have severe my stomach pains, but I'll manage.
Oh, sorry. Speedy recovery.
Okay, let's start. Let's start and finish. So we are going through nursing care delivery models. These are a system delivery models. So we can call it nursing care delivery models or nursing care delivery systems. So you go through introduction, definition of nursing care, the purpose, criteria for selecting, principles of personal assignment, and characteristics of effective assignment. So this is, one important function of the professional. I don't know if you have heard this and if you are practicing this model in your various healthcare setting. Okay, so one way of significant issue challenging nursing is the way in which the nursing care is delivered, and people always, the patient always complain about how care is delivered, and sometimes they are not really satisfied with the care that we deliver to them. So if you're supposed to use this, then it will help in patient delivery. Okay, so in this lecture, we are going to take a look at the different models we have different models of the delivery healthcare to our patients. So what are the nursing care delivery models? Is what, as I said, it can be called care delivery system, patient care delivery models, or healthcare delivery models. And this one, it details the way task assignment, responsibility, and authority are structured to accomplish a goal. Accomplish a goal, that is patient care. So it is what? It's a process of delivery care. That's the definition. The same as a system delivery care to the client by combining various aspects of nursing service, which will fit towards various patient care settings to produce a common outcome of delivering quality care and maintaining the needs of clients. So as I said, it's a written delegated duties to care for group of patients by trained nurses. So that is the way of defining nursing care. What is the purpose? It is to delegate the work to be done to the nursing personnel employed in the unit based on administrative policies, lines of authority, other lines of authority, organizational structure, and job descriptions. It also helps to gain the cooperation of the nursing personnel by knowing and accepting the acceptance of their work to be done. It also defines responsibility of each staff member, provides for teaching of staff nurses and nursing students. So these are some of the purpose of nursing care delivery. These are all the purposes. Lord, these are some of the criteria. Hello.
Hello, madam. Oh, sorry.
Yes.
Sorry.
Sorry.
I needed to go and bonnet. That's so fine. Okay. Let's continue. I need to finish and I have so many things to teach. Okay, so these are the criteria of selecting the appropriate method of nursing care delivery. So when you want to select the type of delivery that you want, the model, you need to consider this criteria: the skills and expertise of the staff, the availability of registered professional nurses. So before you consider a particular model, these are the things that you need to consider. the skills and expertise of the staff, the availability of registered professional nurses, the economic resources of the organization, the acuity of the patient, and the complexity of the task. So these are of the tasks to be completed. So these are the criteria for selecting the appropriate methods. We go through the methods. And these are the principles of personnel assessment, assignments. So it is made by the first line manager, so the head nurse or the in charge for each individual nurse. It's based on what? Nursing needs of each patient and approximate time required to care for that patient. The capabilities, skills, requirements, previous experience, and the what interest of the staff member and the job description. So, as I said, it is made by what? The first line manager. Then it is planned from week to week rather than from day to day to assure continuity of what work. It is also what to take into account all direct, indirect, and unit activities. It considers the geographic location of the units and the assigned duties to save nurses' time and effort. It must be balanced among nursing staff, never to assign the same task to more than one nurse. So these are the major principles of personnel assignment. And these are the characteristics. It should be done according to personnel abilities and patient needs. Should be written clearly, concisely, and legibly, the task. Then it should be posted in a place easily accessible, should be related to previous assignments in order to provide for progressive learning experience. Done on weekly basis, as I said, and adjust daily to meet what's changing patient needs or changes in nursing personnel. Okay, so as I said, we have several methods. Several methods for this. So we have we have traditional methods and in advanced method as well. So these are the traditional methods, methods of nursing care delivery systems. Traditional methods, we have case study, case method, team nursing. So we have case method, functional method. So all that I'm talking about is this method. So how do we use this method in delivering patient care? So that is why I started with the criteria, the purpose, and the characteristics. So these are the methods that we can use in care delivery system. Traditional method, in the olden days, we had a case method, functional method, team method, modular method, and primary nursing. And more advanced, we have the case management, practice partnership, differentiated practice, and patient-centered care. So what is case method? That is total patient care. Total patient care. And total patient care was used in the 18th, not the dates. During era of what? Florence Nightingale, when most nursing care was provided in the homes. So as you can see, a diagram of the total patient care model is shown. As you can see, we have the registered nurse. So it's based on the shifting system. So patient care, the registered nurse plans, organizes, and performs all the care, as you can see. So 8-hour shifts system. So as I said, the case method of assignment, it enables what? It enables one worker to give all the care that patient needs. That is, so in this method, no gaps exist because the nurse knows what has been done and what should be done for the patient. So, however, very often little continuity of care exists from shift to shift. Yes. So the hospital needs all registered staff nurses to use this method of assignment. So it is what? It is the oldest patient care delivery method. And as I said, in this method, one professional nurse assumes total responsibility of providing complete care for one or more patients, 1 to 6, while she is on duty. So you assign one nurse. So as I said, before you can use this model, you need to know the number of nurses available and their workload in the patient. And these are the advantages. High degree of what? Autonomy. Line of responsibility and accountability are clear. Patient receive what is continuous, holistic, and what unfragmented care by only one nurse per shift. And so when this shift, you can see this nurse taking care of you, about 1 to 6 nurse. So if you have about 10, 20 patients, so per shift, 1 to 6 patients, you have one nurse taking care, another nurse taking care of another patient. So as I said, patients receive continuous, holistic, and unfragmented care by only one nurse per shift. So it leads to patient satisfaction and staff satisfaction regarding patient progress and continuity of communication and close relationship of nurse with patient and family. And when the disadvantage is a 1-to-1 ratio is sometimes unrealistic due to what? The shortage. Even if you have a lot of nurses, it is not realistic. And the method is expensive, the nurse's salary, because he or she is taking care of a patient, and you need to also increase the salary. It needs more equipment and suppliers, yes. As a result, in crowdedness in areas such as medication and dressing rooms, need large number of what? Staff. So this is case method or total nursing care. It's total. And with the functional nursing care, that is the task-oriented. And this one, it emerged during the 1950s due to shortage of what? Also nurses. And this method focused on getting the greatest amount of what? Tasks in the least time. So in this method, the nursing care is divided into tasks. So that is why we call task-oriented. And each staff member is assigned. So when we are many on the ward, to perform 1 or 2 tasks for all patients in the unit according to the level of what? The skills required for performance. And the head nurse, he or she is responsible for the direction and supervision of the staff. And he makes rounds with what? He makes rounds with the patients and gives reports to the head nurse. So with the matron, okay, and all the staff as well. And with the registered nurse, so as I said, all staff present, they are tasked to do something. This is what we call task-oriented. So maybe you will be doing administration of drugs, you will be doing vital signs, you will be doing medication, you will be doing wound dressing and all those things. So as I said, the head nurse, he or she is responsible for assigning the task. And the registered professional nurses, they are responsible for administering medication to all patients, another for changing dressing and administering other treatments such as posterior drainage for all patients. So that is how it goes. And if you do this, patient assignment and delivery system will be very easy, and patients sometimes they will be satisfied with whatever task is be given them. And with the technical nurses, they are responsible for taking vital signs, and record intake and output for all patients in the bath unit, while another might be giving baths to all. So with the nurse assistants. And the nurse is responsible for making beds for all ambulatory patients and assisted mobility impaired patients. Then the unit leader are responsible for the telephone calls, writing, and all those things, telling us that we have patients and all those things. So each of the staff in there have their own tasks to perform during the shifts. Yes. So this is the functional nursing method. So assign patient. We have the nurse manager who assigns what duties to different type of nurses. So this is the functional method. And the advantage is that less equipment and supplies are needed. Each nurse becomes highly skillful. She develops speed and efficiency in doing her assigned task. She becomes more independent and needs less supervision. With the disadvantage, function-centered what? It is what? Function-centered method. So you become what? Skillful in one task. The other task, you have also what? You need to struggle to get the other task done. Fragmentation and this depersonalization of patient care. No one else knows or evaluates patient care because you are doing this, you are doing this, you are doing this. So all you come on board to evaluate patient care. It is difficult to define responsibility for errors in patient care. You know, some aspect of patient care are what's said, for example, teaching. So these are all disadvantage of patient care. And the third method is called team nursing, that is democratic team leader. So team nursing, the concept of this method was introduced in the early 90s. So please note the dates, 1950s. It is a method of nursing assignment that binds what professional, technical, and nursing aides into smaller what teams. So these are what team. So this method allows for efficient utilization of technical and or nurses aid through the direction of what? Through the direct supervision, guidance, and teaching of professional nurses. And this one is the most commonly used model, that the team, and it's still used, it's still in use today. The goal of the team method is for team to work democratically. As we are team, as we come in the morning, we are team and we need to work. So the team leader must be both skilled clinician and an effective group leader team. So team conference occur in which the expertise used to plan. So after maybe you have finished, so as I was saying, as I said, so in team lesson, the registered nurse or the clinician, he or she function as a team leader. So we don't have the team leader must be a registered nurse, and he or she coordinates a small team. No, and the team is not more than what? 4 or 5. And also to a small group of patients in a shift. So that is the team nursing. So the size of the team varies according to the physical layers, the environment, layout of the unit, patient acuity, and the nursing skills. So this team is responsible for providing coordinating nursing care to a group of what? Clients. So that is team nursing. And this one, the registered nurse retains sole responsibility and authority for client care, but he or she cannot delegate appropriate tasks to their other team members to do. So that is team nursing. Yes. Hello.
Yes, madam.
Yes.
Please, I want you to explain, go back and go over the team nursing. Because my understanding is I'm not getting it clear.
Why are you not getting it clear? I said the concept of this team nursing, it's evolved in 1950s. In an effort to improve what? patient satisfaction and solve the problems associated with what? The functional nursing, where nursing can what? Function at one place. So the goal of this one, this team nursing, was to reduce the fragmented what? Care and provide personalized approach to the to patient care. So with team nursing, as I said, it refers to a group of staff who work together as a team, a group of staff who work together as a team and share responsibility for the care of what? A specific group of what? Patients. So with team nursing, we have registered nurse, we have nurse assistant, we form a team, nurse aid, whatever, the healthcare professionals that are on the watch. So we form a team, but when we form a team, the registered nurse will be the leader here. And he or she assigns responsibility to that team that we have formed. And we have a team of patients that we're supposed to care for. So the patient can be aware about 1 or 6 people in a team. That is what I'm talking about. So it's just a team. So when we come in the morning, these are the team people to care for this patient. These are the team that we have formed to care for this patient on a shift.
Okay, thank you, madam. Because,
so the team nursing, as I said, it refers to a group of what? Staff who work together and share responsibility for the care of what? A specific group of what? A specific group of what? Patients. So maybe a specific group, we can say this patient, we are the team to care for. So we are the expert to care for this specific group of people. And it is delivering of what? Individualized nursing what? Care to clients by team. So by team. So this one, we are a team caring for these people, specific group, diabetes people. We are supposed to care for them. We are the team that's supposed to care for them. And the team should no more than what? 4 or 5. It's more or 5 of personnel of ancillary. We group all the people. Then we form the team.
okay, thank you, madam.
Yes, and as I said, the size of the team is varies according to the unit. So if you have a small unit, we can have a small size, 3 people, 4 people in a team caring for a specific people of group. So when the process of implementing the team method, one registered, as I said, as you can see from the screen, one registered nurse in the team is appointed by what? The head nurse to serve as was a team leader. The team members commonly consist of at least 1 professional nurse, as you can see. Are you listening, my friend? The one that asks questions.
Yes,
So,
madam.
yes, the team members commonly, as I said, we have a team, and basically the person being the leader is what? A professional nurse. And as I said, it consists of what? At least 1 professional nurse, 1 technical nurse, nursing student, and nursing aides. But in our kind of environment, we have a professional nurse that we can even have based on their status. So maybe we can have principal nursing officer, then the staff nurse. We can also have the staff, the nurse assistant and the technical nurse. We come together. But in all this, we have the group leader will be what? A professional nurse. So all team members may receive reports about their patient care needs from the team leader or team member on previous shifts. So that is team member. So as you can see, we have what? The professional nurse to care for the most seriously ill patient to ensure informed, observed, and skilled informed observation and skilled intervention. And the technical nurse, sometimes we call it the nurse assistant, the nurse aide here in Ghana. To bath, feed, and move and change dressing for patients. But we are a team. But in all this, the team leader, let's say if I am the team leader, I will be responsible for the team. Okay, and the aides, they are assigned to make bath, assist ambulatory patients with bathing and grooming. So that is our team. Then team leader usually administered medications and monitors parenteral fluid therapy. So without the team planning and communication through the team conferences, team nursing may become what in reality just a variation. So when we have a team, we need to plan as to what to do. They also have after the care, then there's a conference discussing what we all did. We all things that we did for the patient. We discuss it and bring our report. That is team nursing. So this team comprises of maybe 6 teams. Then we are responsible for this kind of patient. After the care, we need to what? Bring our reports. Go maybe the conference room or whatever, then do some conferences and discuss our challenges and our whatever we experiences. Then we bring a report to the units. So that is the team nursing. And these are the advantages. Availability of personnel nurse skills for large number of what patients, continuous supervision of what less trained personnel, because if you don't monitor their whatever they do, you, the team leader, will be what accountable for whatever problem that crops up. It increases the number and duration of professional nurse-patient interaction. It helps in developing what leadership skills, because as a leader, now you become a leader, so you also have to apply all the leadership, learn all the skills that a leader is supposed to do. So that is a team. Most nursing programs do not prepare nurses for leadership roles. So when we use this team nursing, it also becomes a problem. The leader cannot lead the people well. So if you are skillful in performing or the leadership role, then team nursing is good. Nurses are more interested in developing clinical patient care skills than leadership abilities. So this is also a problem. So with staff shortage, it is difficult to properly apply this method. But when you use this kind of method, as I said, leadership skills is developed. So even you are taking the in-charge nurses duties. So whenever the charge nurse is not around, you can also assume duty as a charge nurse. So these are the advantages and disadvantages of team nursing. Then we also have the modular nursing or the district nursing. So this is a modification to the team nursing.
Okay.
So a modification to team nursing is the modular nursing or district nursing. And this one, it focuses on the geographic location. So it's focused on the geographic location of patient rooms and assignment of staff members. So let's say this is a mini team, 2 or 3 members approach. So the modular nursing assignment is used when the nursing staff includes technical and nursing needs as well as professional nurse. So it's a kind of modification of team nursing. Although 2 or 3 members are assigned to each model, the greatest responsibility for the care is of assigned patient force under the professional nurse. So Act 1, this one, as I said, it's a modification of the team nursing, but this one, it's focused on geographic location, wherever the person is. That is where we do the team. We do the modular nursing. So as I said, this one, the client's unit is divided into models. That's called a modular. So in geographic location, into models or districts, as you can see, modular nursing or districts. And the same team of caregivers are assigned constantly. So we have our own team. Then we have assigned constantly to the same geographic location. So each location or model has a registered nurse as a team leader, and the other team members also. So the content of this model, it calls for a smaller group of people providing nursing care to a smaller group of people in the geographic location of patients. And this one, the major goal is to increase the involvement of the RN in planning and coordinating care. And what are the advantages? So you can see the nurse manager. Then we also have the geographic units, so patient care. So where we have what? The team, the RNs, the nurses. Then, as I said, need to supply all the things that they will need to care for the patient. So the medic, the supply, and the learners in one geographic unit. And you also go to another geographic unit, we form a team. And then also go for another geographic unit, we form a team. So these are the models. So model 1 here, we have our team. Model 2, we have our team. Model this model, we have our team. So that is what was team modular nursing in what? A modification of what? Team nursing. And these are the advantages and disadvantages. It decreases the sense of isolation and unrealistic what? Expectation. It increases what? Continuity and quality of care. More time may be spent in district care. Nurses' morale is what? Improved. And this is the disadvantage, increased cost to stock each what? The module. When you create a team, long corridors common in what? Many hospitals. And what are the primary nursing? So what is primary nursing? Primary nursing, as the name implies. So this method was also conceptualized by Marie Manti and implemented during what? The late 1960s and early 1970s in an effort to improve autonomy and equality care in a professional nursing practice. So Louis Marie Manti also is a proponent of what? This primary nursing. As I said, this method is what the best in an agency with all professionals, nurse staff. So it is a comprehensive, continuous, and coordinated nursing process for meeting the needs of each patient. So a nursing care delivery system. So this is a system in which one nurse is responsible and accountable for the nursing care of a specific patient for the duration of their stay. So that is primary. You as a nurse. That is why we call it primary nurse. As I said, it is also known in relation-based nursing, developed in late 1960s, as I said, by Louis Manti. So the primary nurse is responsible for 24-hour a day total patient care. So the primary nurse, as I said, is responsible for 24-hour a day total patient care from admission through discharge. So let's discuss. So if, let's answer this question. If she is responsible for 24 hours, if he or she is not around, you know what will happen? Will happen if this person is not around, because the person is supposed to also go and rest. But this primary nurse is what? Responsible for what? 24-hour a day total patient care from admission. So through discharge. I'm asking a question. If this person goes for off duties or weekend, or maybe she or she is sick, what will happen to this model? What happened to this model? Hello.
Yeah, madam, there will not be a continuity of care. Then
Sure?
the model will, yes, it will break.
Okay, you. Okay, what, Eben, you raise your hand.
Doctor.
Yes.
When that nurse is not available, it means that there will have to be a different nurse to care for this patient, and then the nurse will not be conversant with the treatment plan and all that. So it means the nurse will have to learn everything over again.
Okay. So in this one, you see that, have you looked at the diagram? Well, we have the primary nurse, 24-hour responsible for planning direct, but we also have associate nurse. He or she provide care when primary nurse is off duty. Can you see the diagram?
Yes.
Yes, madam.
Yes. So it's still the primary nurse, that is what primary, he or she is responsible. But when he or she is not around, we have the associate. So when the primary nurse is not on duty, associate nurse who follow the care plan established by the primary nurse provides the care. He or she provides the care. So the primary nurse, preferably what? A degree nurse or whatever, prepared with autonomy, responsibility, and accountability, accountable for what? Meeting outcome criteria and communicating with what? The patient, the physician, then the associated nurse. So the associate nurses and other team members. So also it is what designed for hospitals, it is used in home, this kind of model. It is designed for what? Patients, hospitals, the homes of health nursing, hospice nursing, and other healthcare delivery systems. So these are the things that, what would be the advantages and disadvantages? It decreases the number of people in the chain of what? Command. I've taught you about chain of command. Reduce the number of what? Error and cost per patient per day. Mobile use what? Auxiliary. Here. So you can see one primary nurse, but when one primary nurse is not around, even though we are a team, I am responsible for you for 24 hours. But when I'm off duty, I have my associated nurse who also knows everything about you. So he or she will also continue with the treatment. When I am returned to duty, he or she will brief me what happened concerning the patient. Yes, that is the primary. That is why we have the primary. It confines a nurse talent to a limited number of patients. That is the one disadvantage. It is time consuming. Its success depends on the quality of nursing staff and administrative supports, and even the associate nurse that you also with. It requires excellent communication between the primary nurse and the nursing as you said, if you are not there, the continuity. So if you don't, the primary nurse, you don't communicate well with the primary nurse, you can see continuity of care will also be affected, as you said. So these are the disadvantages of primary nurses. And let's go through the more advanced methods. So we have gone through the older methods. Then let's go through the advanced methods. So with the advanced method, we have the practice partnership, that is co-primary nursing, co-primary. So we just talk about primary nurse. With the practice model, partnership, the partnership model sometimes referred to as the co-primary nursing. And this one too is a modification of primary nursing and was also designed to make more efficient use of the registered nurses. So a nursing care, this one is a nursing care delivery model system in which senior and junior staff members share patient care responsibilities. This one also introduced by Marie Manti. So with this, as I said, with this one, it can be applied to the primary nursing used in team nursing model, modular nursing, total patient care as well. And this one, it offers an efficient way of using the skills of a mix of people, professional and non-professional staff with different levels of we all come on board as a co-partner to help deliver a model and nursing care to patients. So as I said, this one is a form of primary nursing, modular nursing is a pattern of a partners in practice. That is partnership, a partners in practice. Yes, David.
Yes, madam, please. So how is it different from the team nursing? Because if they are
so this different from team nursing is a form of team, but this one, as I said, the partner is we have our own team, but this one we also have our co-partner, co-primary nursing, co-partner. So with this, it is a modification of this one is not team, it's the modification of primary nursing, and was designed to make more efficient use of the registered nurse. But this one can be applied to primary nursing and used in team nursing, as you can see. It can also be used in team nursing where you have all our partners. Then we also form a team. But this one, the team can be the partners. We have our partners, but we also have our co-primary people that can help us when the team is not around. So that is team nursing. So in partnership model, the registered nurse is partnered. Listen, the registered nurse is partnered with what? Maybe licensing practice nurse or unlicensed assistive personnel, and the pair work together consistently to care for an assigned group of patients. So and this one, so as a team nursing, we are all teams. But this one, you can be partner with professional nursing or unprofessional nursing. And so these are the pairs, and the pair work together consistently. But as a team nursing, we are all in one team. But this one, my partner is you. We are not a team, but my partner is you. So when I'm not there, you can. They're online, but still, the RN is still in charge. But I am partnering with a member to also help me deliver pay. So, and the pair, so this time we call it pair. Pair, we pair them together constantly to care for patients. Yes, hello. Yes.
Hello, Doc. So please, what's the difference between this pair and the one in the primary model?
So as I said, this pair, the primary model is what? Is the RN is only what? The leader. The primary, as I said, the primary model is what? This one is a modification of the primary. So with the primary model, I am solely responsible for what? The patient care. But this one, I am paired with a co-primary nursing. So whatever I do, my partner is around. But with the primary nursing, it is when I am not on shift duty. That is where my associate nurse with what will assume duty. Are you?
Okay, thank you. Very clear.
Are you getting it? So this one is co. So even if I'm there, I am the primary nurse, but I have my other partner with me working together. But with the primary one, I am the duty unless I am off duty, where my associate nurse will also come in. You understand? So we are paired together consistently. Yes, we are paired together. Unlike the primary one, I am responsible for 24/7 shift responsibility. It is when I am off duty that is where my associate nurse will also take over. But this one, we are all together. We are all there. We are partners. So we can be here, we can be here, we can be here. So that is the difference, the major differences. Where the primary nurse, the associate nurse will take over when I am on shift duty. But this one, I have my co-primary there. We all work together. So it's not like when I go, I'll call my co-partner. No. When I'm not there, this one is there. But it's always constantly with me. We are paired together. So that is the partnership. We are in partners. Partners in crime. We can say partners in crime. So partners in work. So and the pair work. So we pair each of them and they work together consistently. As you can see the word, consistently to care for an assigned group of what? Patients. So that is it. So these are the practice partnership, the co-primary. So as I said, that is why I had the co-primary. But this one, the primary is only one person responsible for 24/7-hour shift. So more continuity of care and accountability for patient care than team and modular nursing. Less expensive for the organization and more satisfying professionally for the partners than total patient care and primary care. The RN can encourage the training and growth of his or her partner. Yes, so and these are the advantages and disadvantages. The potential for the junior member of the team to assume more responsibility than what the appropriate. It's also there. Okay, so these are the advantages and disadvantages. Then the case. So the case management, this one, it emerged in response to the complexity of third party. I think you've been doing case management, third party healthcare payers and rising health costs. So it is what? Dynamic and systematic collaborative approach to coordinating healthcare services for a defined population. You know, with a case manager, you have a case. He or she monitors an individual patient healthcare. So this one, you can tell me that's what an administrative thing. The case manager monitors an individual patient healthcare to minimize positive outcomes and control costs. So with this method, the model identifies, the model coordinates, and the model oversees the implementation. So here, it's kind of administrative work. The model is the case management. So as you can see, the case management. It identifies, coordinates, and oversees the implementation of services, the services that we render to patients to achieve what a desired patient outcomes with specified period. So sometimes when the patient comes, because we want to reduce costs, we need to monitor the patient well, manage the patient well. Within 3 days, the patient will be well and discharged home, and the cost will be lesser. So case management focuses on, as I said, administrative aspects rather than what direct healthcare delivery. This one, it organizes care by major diagnosis or diagnosis-related groups. So if you have this group of people, diabetes people, diabetic and hypertension, we group them together and we deliver the care as we've been doing to achieve a predetermined patient outcomes within set time frames and reduces resources. So this is the management, the case. So it was developed in, as I said, in 19. So as I see, the case manager. The case manager assesses, plans, implements, coordinates, and monitors and evaluates patient care options and services to meet what? Health needs. He coordinates services, that is home, whatever, collaborates with nursing, physician, physical, speech, occupational, whatever, and this person to care for patients. So collaborates with patients and family as well. So as I said, it was originally used in community and psychiatric settings before being adopted for acute inpatient care and outpatient services. And it aims to coordinate care, maintain quality, and manage what cost effectively, because the manager sees to it that things goes on well without what. So we also have the case manager, case coordinator. Who will be the coordinator? So the case manager is a professional nurse who with advanced level of nursing practice and advanced managerial and communication skills. So within this case management, there's one person who is supposed to coordinate this care, the management for clients' care. So the ANA recommended a baccalaureate in nursing, so a degree in nursing with 3 years of clinical experience. You need to apply for this position because you're becoming a manager. Now we have the master's degree. So as a minimum qualification, you need to have BSc or degree, and with the highest qualification. So if I am applying for a case manager, we have 2 degrees and we have masters, and the masters do well, then obviously the master's student will be picked for the case manager. So as I said, in an acute care setting, the case manager has a caseload of about 10 to 15 patients and follows the patient progress. Yes, we go to this this one, and follows patient progress through the system from admission to the start. That's the case manager's work. The case manager is responsible for assessing clients and their homes and communities, coordinate and planning client care, monitor clients' progress, evaluate client outcomes. You also has the responsibility for planning, implementing, coordinating, and evaluating care for patients throughout the period of illness, regardless of what the patient's movement among various units and services. So you are responsible. You follow the person, such as emergency room, surgical units, recovery units. You follow the person, so the person recovers and goes home. So he or she ensures that plans are made in advance for the next needed steps. So what am I going to do? Through this, the manager assists with decision making and helps to ensure that the patient receives care that will achieve the most positive outcome in the most efficient manner. So these are the components of case management. The person assess patients, you know what assessment is. So the first role of the case manager is to collect and analyze what comprehensive information or data about the client's, his or her relatives, and available healthcare for resources such as the health insurance coverage. So that is the duty. As I said, it is purely administrative work. So you need to assess the physiological status, psychological status, cognitive and functional abilities, and spiritual beliefs and financial financial resources. Then he also plans for the patient. You know what planning is about? The plan of care is developed based on what? Comprehensive analysis of information that you have gotten from the assessment. So the care plan, you can use the care plan, which should be what? Client patient-centered, evidence-based, and transdisciplinary, and is developed in in collaboration with the patients, their family, and the healthcare around. So that is planning. You also need to implement after you have implemented. Yeah, hello. Daniel.
Yes, madam. Doc.
Yes.
Please, based on the assessment that I want to ask, it's more or less a general question, but
okay.
The assessment, I want to find out whether there are limitations for assessment, for assessing a client based on the level of facility, or there's no limitation.
Assessment is assessment. What do you look?
For example, like maybe a client coming to meet you in a health center.
Yeah, okay.
And then maybe the kind of assessment that would be needed, and then a client coming to meet you in a hospital, the kind of assessment that would be needed.
So as I said, so it has to also it depends. But assessment is assessment. What do we need from assessment? We need the physiological status data. We are collecting data. We need psychological status data. We need the cognitive. We all take this kind of assessments. Sociocultural and lifestyle. So as I said, we need that assessment basically collecting information from the patient. So based on the assessment that we have, then we plan for the patient. So what kind of differentiation are you looking at? Hello.
Hello, Doc.
No, or what kind of what? Because this when we are in a confirmatory hospital, when we are in a healthcare center, we need to take all these kind of assessments. But it depends on the patient's problems and their conditions. And you need to direct your assessment towards that problems or the patient conditions that he or she brought to the hospital.
Okay. Yep.
So then, yeah, welcome. Then based on the assessment, you plan. And after planning, the next is what you implement. you implement whatever has been done. So during this stage, the implementation stage, as I said, during this implementation stage, the next case manager becomes what? Involved. You know, implementation, that is where we put into practice whatever we have learned. So the next case manager responsibility might include what? Performing care or more usual delegating client activities to other members. And the coordinator can also what? Facilitate and coordinate various aspects of the plan of care. So with this one, the coordinator ensures that implementation of the care plan in a safe, time, and cost-effective manner. He coordinates services and referrals to providers or agencies. He uses appropriate community resources to implement care and document progress towards achieving goals and outcomes. Then assess accountability of implementation of the care plan. So after implementation of the care plan, then you evaluate. So you need to monitor progress when you're evaluating. You monitor the client progress towards accomplishing what? Established goals and outcome, as well as what? Evaluating the component of the case management processes. So you can do the evaluation through what? Direct observation. You can, yes, direct observation. Based on that, you can get something. You can also interview. You can also do surveys and verbal feedback from the clients, their relatives, and members of the healthcare team. Based on that, you can also use this one to evaluate the client's care. You document reviews. You can also do this through documentation review. The reports that we have, you review them, you can show that, and the chat audit, you can use that. Suleimana, please stop what you are doing. Suleimana, please. Suleimana, stop it. Suleimana, stop it. You are destroying my... So these are the advantages of the case management model. It enhances nurse professional development and job, increases collaboration between different health professionals, reduces patient complication, improve quality of care, facilitating the continuity of patient care, facilitate discharge of patient care, and reduce costs as well. And these are the disadvantages. So if the coordinator is not well prepared, it may not be able to make the necessary clinical decisions or communicate effectively with the other healthcare team. Patient outcomes might not be achieved within a specified time frame, and implementation may be difficult. And there is possible conflict of interest may arise between the nurse case manager and the other disciplines, such as the social worker. Sometimes you delegate conflicting workplace responsibilities. It also considered as expensive because it usually relies on a broad range of personnel with high level of the minimum qualification is degree. And with the critical pathway, apart from the case manager, we also have the modern models, critical pathway, and they also called critical paths, practice protocols, and the clinical practice guidelines. So that is what the critical pathway is: patient care protocols or care maps. And this one is a predetermined written plan of care for a particular health problem. Yes, the critical pathway. So we use practice model.
Check your noise. I'm doing the work tool, so it's not just about writing it, but okay.
So these tools or
semester
guidelines, that's direct care by what? Identifying expected what outcomes that are developed by the collaborative practice team. So this is a practical pathway. That is where we use our guidelines developed by some.
using it as a class to pay. May semester is down too.
Oh,
As to whether it's true.
please keep quiet. You are disturbing. Oh. So successful case management relies on what? Critical pathways to guide care. And as I said, the critical pathways are what? We have the practice model, it is in the watch. We have the clinical practice guidelines, it's on the watch. Patient care protocols or care maps, they are all there. So that is where you refer to when we are delivering care to the patient. So that is the critical pathways. So the critical pathway, I said, includes specific medical diagnosis, the expected length of stay, patient identification data, appropriate time frames, that is in days, hours, minutes, or visits for interventions and patient outcome. So that is the critical pathway. And the patient-centered care. Patient-centered care. A nursing care, this one is a nursing care delivery system that is unit-based and consists of what? Patient coordinators, patient care associates, unit support assistants, administrative support personnel, and a nurse manager. And this one, it was developed in the 1980s, and it may be used in OPDs, home cares, patients with chronic conditions, or appropriate conditions for patients, and even monitor pregnant women. So it can also refer to as what the patient-focused care. That is where the midwife use. It's more recent development in nursing care delivery models, and it's a result of what design. So in patient-centered care, all patient care services are unit-based, as I've explained earlier. So this one, including what's admission and discharge, diagnostics and treatment service, they are all in one part, one area. So it's focused on decentralization, the problem of efficiency and quality and cost control. So that is patient-centered care. And this one, it consists of what? Patient care coordinators, patient care associates, unit support assistants, administrative support personnel, and a nurse manager. As I said, it can be used in our specialty, always. These are the advantages and disadvantages of patient care, patient-centered care. So patient comes into contact with fewer workers. Workers are unit-based and spend more time in direct care activities. The registered nurse is accountable for a wide range of services and functions at a high level. And these are the major disadvantages. Major changes in organizational structure is required, yes, because all, as I said, unit-based, so all activities will take place in one place without moving to another place. So in one place, we have the nursing units, we have the medicine, the pharmacy, the lab, the X-ray, everything is in one person, in one unit. So you don't have to go to outside or the ward or the unit to do the labs. It is all based in the unit. So more major changes was required also in the roles of the nurses, manager, and the team members. Okay. So these are the advantages, the disadvantages. We also have the differential practice model, differentiated practice model. And this one is a nursing care delivery system that maximizes nursing resources. So let's see a differentiated practice model. As I said, the differentiated practice model. Oh, Jesus Christ. Okay, as I said, this one is what? A nursing care system. That's maximizing what? Nursing resources by focusing on the what? The structure of nursing the roles according to education. So according to what? Education, your experiences, and your competency. So with this model, we will look at your educational background first and your experiences and the job and whether you are skillful, your competency. So we don't want any nurse who is not competent. We won't use this nurse for a differentiated model. So this one, it has been used in a variety of inpatient acute care settings as well as what? In-home care settings. So it is designed to identify distinct levels of nursing practice based on their what? Defined abilities that are incorporated into job descriptions. So sometimes you look at your educational level with masters or whatever, then you use this paper. So this one is expensive. You use this paper to what? With this paper for the model, differentiated what? Practice model. So the aim of is to match what patient needs with nursing competencies to facilitate the effectiveness and efficient use of what? Nursing resources. So nurses prepared at what? Associated what? Associate, diploma, degree, masters, and even doctorate level what? So this one is high model. And so we have people with this different what? Educational background, especially with even the higher what? Doctoral what? Level. So its defined role is different and complementary. So nurses choose the role based on their what? Yes, your competency, your skills and your desires and what? Educational level. So that is differentiated what? Practice model. And these are the advantages: improves patient care and contribute to patient or safety, allow for the most effective and efficient use of what? Scarce resources, increase satisfaction for nurses, provide opportunity to compensate nurses fairly based on their expertise contributions. And the disadvantages are there is discrimination between licensed and not. Yes, of course, and unlicensed what? Personnel. Identify the required or competent nurse might be difficult. But now we have a lot of nurses with what? PhDs, masters, and degrees. We have a lot of them. So several caregivers are involved with care rather than just one person, and this results in task-oriented versus what? Total patient care. There's what? Fragmentation of what? Care. How do we evaluate this care model that we have discussed? So as I said, when we are evaluating the type of the model that you want to use, you need to ask yourself these questions. Are patient outcomes being achieved in a timely, costly, effective manner? So after you have used all the, we have gone through the models, and maybe you have chosen one particular model, you need to evaluate it to see if that particular model fits the care of the hospital that's the model is being practiced. So this question will help you also answer and make an informed choice. Are patients and families satisfied with the care? Are physicians and other health members satisfied with the care? Does the system allow for implementation of the nursing process? Okay, so these are the things you need to evaluate for. So in conclusion, I'll give you an assignment. Have I given you any assignments?
No, madam.
No, I've not given you any assignments, so I have to give you assignments. So nursing care delivery models impact patient. Okay, I'll give it to you. Quality care. Choosing the appropriate model enhances efficiency, And you know that we are in the midterm week. And I mean, we are not going to use our Fridays. We can use weekdays. So whenever you're ready, go to the thing. I will let you know, okay? And I had to give you some slides. Remind me, okay? To give you
Yes,
the
madam.
Uh-huh.
We need a
So flexibility and adaptation to healthcare changes are vital. So no single model is universally superior. Effectiveness depends on what? Setting and resources, patient outcomes, and nurse satisfaction must guide this model selection. Okay. So which model do you think? This one is not the assignment. I'll give more challenging assignments. This one is discussing model. Which model do you think best suits Ghanaian healthcare settings? How can we improve patient-centered care in resource-limited settings? How do staff challenges influence the choice of? Hello. So I think I will modify it and give it to you. So next time, stop writing on the screen. You have destroyed my screen. Do not do that, okay?
Okay.
Okay, so remind me.
Yes, please.
Okay. I need to prepare the notes and give it to you. I'll this week. I'm very busy.
How many questions?
This time is 80. I'll do why? Do you want written or MCQs?
MCQs.
Dr. MCQs.
MCQs. MCQs.
MCQs.
MCQs.
Okay. Okay. MCQs, 80 questions. So I'll see you next week. Yes.
Thank you very much, sister.
Okay.
We wish you
Thank you, doctor.
Thank you, doctor. We wish you speedy recovery.
You're welcome. Oh, it's not easy. I'm still having problems. Today, it's not easy for me, but I'm managing. I can't stop this.